Hi, my name is Jonathan Baldwin, and I am an assistant professor at the College of Allied Health, Department of Medical Imaging and Radiation Sciences.
Hi, I'm Wendy Galbraith. I'm a clinical associate professor in the Department of Pharmaceutical Sciences at the College of Pharmacy, in particular teach nuclear pharmacy track.
And our talk today is going to be nuclear pharmacy and nuclear medicine technology, taking the relationship to the next level for students. Before we can talk about our collaboration, we have to define our professions first. So nuclear medicine is a clinical imaging profession that focuses on physiology. We give radioactive drugs to our patients that go to different processes of the body to show what those body parts are doing, to see if there's pathological processes going on or if there are normal processes going on. And we are totally dependent on our radioactive drugs, which we call radiopharmaceuticals.
And the nuclear pharmacy is the department that provides those radiopharmaceuticals. And so, it stems off a branch of pharmaceutical sciences and really takes a lot of basic science and translates that into a clinical situation. So we have to provide the radiopharmaceuticals in a certain form of quality to the nuclear medicine department.
And because of our symbiotic relationship in the clinic, we have become to get a lot of collaborations between the departments as well, both educationally and via research wise. And so we wanted to talk a little bit about those today. We wanted to cover some of the educational labs that we have for both nuclear medicine and pharmacy students, and some of the research that have sparked between the two departments for both the faculty and the nuclear medicine and pharmacy students. So this presentation will highlight two of these.
So something that is really important in our nuclear pharmacy training program and is unique to the University of Oklahoma is that the students get to spend a lot of time in the clinic and where they see the image of the radiopharmaceuticals that they've prepared. So they also get to see the quality control that's involved within the imaging processing and the cameras that go into creating the image. And so it's not just the radiopharmaceuticals, but seeing the end product and the outcomes of those radiopharmaceuticals. It helps the collaboration between the nuclear medicine faculty and the nuclear pharmacy faculty. We have a very tight relationship. And in fact, we depend on the nuclear medicine faculty at the College of Allied Health in order to bridge that gap from a clinical imaging laboratory in particular, and then the quality control that goes on in the clinic with the patients. So without that interprofessional approach, we wouldn't have the kind of respect and the relationship that these students are going to have to depend upon when they leave their training program. So within the laboratory setting, the pharmacy students get hands-on experience with the imaging equipment and the quality control. So on a day-to-day basis, without these laboratories and the collaborations that take place, we would be making our radiopharmaceuticals basically in a hole without experiencing the imaging and the processing, what the outcome is. We wouldn't get to see how we can troubleshoot best and enhance the technologist's job, and also provide as much safety and knowledge and troubleshooting for most effective patient care.
And for the interprofessional faculty, what do we get from these clinical laboratories? So we talk amongst ourselves throughout these laboratory dates throughout the year, and we find different updates. For example, there was just a large USP update that affected nuclear medicine technologists. We talk about that. We learn about these updates from one another. Also, for the pharmacy side, they learn about clinical imaging protocol updates from the clinic, from us. So we give and take different things that we get that we learn from these situations. Our relationship also gives us lets us see the relationship between quality control and image quality. all the way from the beginning with quality control of the radioisotope to the end with the quality control with the image. What do our students get out of this? They get aspects in physics of all of our imaging equipment for the pharmacy students and the nuclear medicine students as well. They learn how they work. They can actually get hands-on with them. They can drive $1 million machine in the clinic just for fun and see how a patient feels laying on them. And they get to experience the whole picture, not just their part of the situation. On to more of our research topics now.
So one of the projects that bloomed out of the relationship was there, in the past, there's been a lot of shortages in supply chain. And one of those was our radiopharmaceutical that was used in a nuclear medicine gastric emptying study. And there was a lot of talk about what drug can we substitute as radiopharmaceutical that'll give you a similar study so the patient doesn't have to be postponed. And so the idea came up from a student. So they had heard about MAA being used in other parts of the country. And so the nuclear medicine student got involved and we worked together to try to see if MAA was actually a viable solution as a substitution for the sulfur colloid that was on shortage.
So this project involved both a nuclear medicine faculty, myself and Dr. Galbraith, and the nuclear medicine student that brought this up. We met on multiple occasions and we acknowledged each other's roles and mutually contributed to the design and also execution of the experiment. We had multiple brainstorming sessions on how we were going to measure different outcomes, how we were going to set the experiments up. And in the end, once the experiment was executed, we discovered that technetium-99m MAA could be used for these gastric emptying studies. However, normal values need to be considered because in the presence of PEPs in the MAA does break down a little bit more than sulfur colloid, but it's still viable for use. The nuclear medicine student experienced a team approach of science through this and solving real-world healthcare problems as a team. The nuclear medicine, what we got out of this experiment is we learned about radiopharmaceutical efficiency given different chemical conditions. Many times us as nuclear medicine faculty and technologists, we don't actually think about the chemical conditions that affect our radiopharmaceuticals. So that was something that we got out of this. It also reinforced laboratory skills that are more common to pharmacists rather than clinical technologists.
Mm-hmm. And in particular, this one situation brought to light with our pharmacists that there are clinical situations that can be brought to our knowledge where we can give a substitution of a radiopharmaceutical to fit the need. So the communication is there so that we can solve the problem in case there is a shortage, like in this one situation. It also brought to light, in particular, that different departments have different preparation techniques for radiopharmaceuticals in the clinical setting. So it drove home some of the differences so that we could more coherently understand perhaps what's going on in the clinic setting just because of preparation of the radiopharmaceutical.
And the nuclear medicine student, they got laboratory techniques. They got to observe the research design process in a multi-modality science situation. And they also learned a lot about pharmacy guidelines and limitations when it comes to pharmaceutical preparations. All right, so we wanted to just hit on the IPEC competencies. I know we're running short on time here. So core competency 1, we maintain a mutual respect relationship between both the nuclear medicine department and the nuclear pharmacy collaboration. Each of us know that we offer something genuine and different to each problem. We work through problems together, and we value each other's support and contributions to those problems.
Core competency number 2, we certainly share our expertise to address specific problems. We've just given you 2 of those examples today, both in training and in the clinic-specific situation as far as substitutions. And so whether it's an educational goal, we work so closely together that they complement the two programs complement each other and enhance the students' learning. And that's what it's part of being on an academic campus, that we can share our respective professions and intertwine them. And so it absolutely creates a safer environment to have those base relationships. As a student can see them, a safer relationship for the patient.
For core competency 3, our collaboration allows us to communicate with professionals of other fields to form lasting relationships. Like Dr. Galbraith said, this is only a couple of examples. We've actually had research studies where we brought in chemists and we brought in respiratory specialists, microbiologists. So these all allow us to make that team science contacts that people need. And for students, they get to see what working together is like for when they actually graduate and begin to work together in the field.
That's right. And that leads to core competency number 4, the last one. None of us are working in a vacuum. And so this relationship shows the students how we can communicate and depend on each other. And that's taken right into their extended learning into the profession. And the collaboration leads to a better patient care.
We would like to thank everybody for listening to us today, and we encourage any questions that you have. Thank you very much.
Thank you.